Hey guys, my name is Bailey, and today I wanted to make a video talking about feeding as well as oral care for your patients at home, your family members at home. These things sound really simple, and they are, but there's a couple of things that you definitely want to watch for just to make sure you're doing them safely. So first we're going to watch a video about how to feed a patient. So we'll go ahead and watch that and then we'll talk about it a little bit.
Hi Bailey, my name is Gabby. I'm your CNA today, and today we're going to feed you your lunch. Okay, I'm just going to raise up the head of the bed. Would you like a clothing protector?
Yes, please.
Okay, I'm just going to wash your hands. For lunch today, we have cereal, yogurt, toast, and banana. And to drink, you have milk. What would you like to eat first?
Yogurt.
Would you like anything else?
Some bread, please.
Would you like some milk?
Yes, please.
Would you like anything else to eat?
No, thank you.
Here's your call line and your water. And let me know if you need anything.
Thank you. So first of all, a huge thanks to Gabby at Syracuse High School for helping me out with this video, and their CNA instructor, Mrs. Porter, for filming it for us. They were a huge help in making these videos. So some great things that Gabby did during this skill was raising the head of the bed. So if you have a bedbound patient in a hospital bed, definitely raise the head of the bed, or if you can get your family member sitting up in a chair, that's obviously the best also. So just making sure the head of the bed is raised, that's going to help prevent them choking on anything. And then she also helped me wash my hands first, which is awesome, even though I'm not touching any of the food, because as the patient in that video, she had to do everything for me, so she still washed my hands, and that just makes me feel, a little bit better about myself, more like a human being, I guess, washing my hands before I eat food. And then she also offered me a clothing protector, which is great. It just keeps your clothes clean. The less laundry you have to do, the better, so that's always a plus. And then, so a couple other things that you want to watch for as you're feeding. Make sure that you're giving small bites. I know it takes longer, but they're less likely to choke or to pocket food, which is basically where they take the food and they put it in their cheek and they don't actually swallow it. So that's not really what we want. We want them to eat the food. So especially if you have a family member or loved one with dementia, definitely watch for that. That's something that can happen a lot. So make sure that they're swallowing their food, and especially if you're giving medications with food, sometimes we'll crush up medications and put in your applesauce or yogurt and feed them to a patient. Make sure that they're not pocketing those. That can actually be slightly dangerous because medications are often made so that they're digested in the stomach and released slowly. So if they are just sitting there in the cheek, they're not getting digested in the stomach, they're getting absorbed into the cheek. So it's, a different route. There's sublingual medications, so you want to make sure that they're actually swallowing those for sure. And then another thing to look for as you're feeding your loved one is any coughing or choking. That can indicate that they're not able to swallow this food safely. So if you notice any coughing or choking, stop feeding and let your doctor or home health agency or whoever know that this happened. And they might want to do a swallow study and make sure that your family member actually can swallow this kind of food safely. If not, they might adjust the diet. So, like, maybe no thin liquids or a pureed only diet, something like that. Just to keep your family member safe. You don't want them choking on food. And then another big thing, I'm sure you guys know your family members and their situation way better than anybody else. So, know their diet as well. There's kind of a lot that can go into the care of a patient, and it can be really overwhelming at first, and trust me, eventually, if you care for them long enough, you're probably going to know more than the nurses working with you, honestly. So know their diet too, know what stuff they can and can't eat, and that's going to go a long way to helping them get better. So next we're going to watch an oral care video. This one's for an unconscious patient. Conscious patients, you can pretty much do it the same way that you would do yourself. Maybe just add a clothing protector in there, as long as they can protect their airway, which we'll talk about after. You can pretty much do it how you would yourself or a child. So let's watch that video and then we'll talk about it. My name is Bailey. I'm going to be your nurse today. We're just going to help you with some oral care. So this nice lady is unconscious, so there's a few things that we're going to do different. It's not just like how you would brush your teeth at home. So I'm just going to put on some gloves. We're going to take a few precautions just to make sure that the liquid that we're using doesn't get into her lungs, because she can't protect her airway like someone who's conscious could. So one thing, she's already got her head turned to the side, but if she were like this, we would help her turn her head. If her neck were pretty stiff, we could just turn her whole body toward us. But that's just going to help any excess fluid flow out of her mouth rather than into her lungs. And if you have a hospital bed, raising the head of the bed a little bit is going to help too. So I have a cup here with some mouthwash and some swabs. And I also have some chapstick and a cloth. So I'm going to take the cloth and just put it under her cheek right here, just to catch any fluid. You don't want to do more laundry than you have to. So I'm just going to take my swab and get some mouthwash and then squeeze out any extra along the rim. And then I can go ahead and start cleaning her mouth. So you just want to make sure that you get all the sides all around the tongue, the inside of the teeth. Then I would get a couple because they're probably going to get a little bit gross. So you can throw one away and then grab a new one. Get all along the cheeks and around the teeth. And then you can either squirt out any extra or just grab a dry one and just dry out their mouths a little bit, make sure there's not any extra liquid in there. throw those away, and then we can grab our chapstick and put some chapstick on. Their lips probably will get pretty dry if they're unconscious, so helping them out with that will be nice for them. And then clean up anything that's spilled. We'll put this in our dirty laundry, and then we can either lower her back down if that's more comfortable, or keep her up if she likes that. We'll put her back down. And then turn her head back. And then if you have a hospital bed, you would have raised it up to a comfortable working height so you're not bent over like this and hurting your back. But when you're done, you always want to lower it all the way down as far as it'll go. Okay, so there's not a whole ton to talk about after that video. Basically, the main things is that an unconscious patient is not going to be able to prevent any liquids from getting into their lungs. So they could choke, they could develop aspiration pneumonia, which can be pretty dangerous. So make sure that you're doing everything that you can to keep liquid from getting back into their lungs. So that's why we turn the head sideways, and why we use swabs rather than just a toothbrush with a bunch of liquid. And another thing that you can do that they have, so at hospitals we have suction units hooked to the wall that we use. So we can just sit the patient up and clean out their mouth and suction out all the secretions and the liquid in their mouth so that they don't aspirate or choke or get the liquid into their lungs. But at home, you don't have that. But they do have portable suction units. So if you have an unconscious family member that you're taking care of and that interests you, you're worried about liquid getting into their lungs when you're brushing their teeth or anything like that, then maybe look into that, a portable suction unit that you can just turn on. And it's kind of like the thing at the dentist that they just stick in their mouth and it sucks out all the liquid. So that might be something to look into. Again, if you have any questions about feeding or oral care that I didn't cover in this video, make sure to let me know in the comments and I'll try to answer them the best that I can. I also have other videos about ambulation and transferring a patient and about how to care for a bedbound patient. So check those out if you're interested.